Namaste. I hope you have had your breakfast. Today was a relaxed Saturday morning. Most of us would have had our brunch. Now we are wondering whether to just lie down on the couch and watch a movie or probably take up some unfinished tasks. While we are doing this, there are lakhs of people on the ground fighting the coronavirus. While we have a choice of just sitting at home and enjoying the favorite movie with a favorite snack, there are lakhs of people on the road at this point of time who are facing the danger of contracting the virus. Yes, from today for the next few days, I would like to focus on these COVID warriors, people who are fighting it out on the ground level, ground zero, on a daily basis to ensure that our country is safe from the coronavirus. Today I will be focusing on one selfless breed of warriors who have really brought tears in my eyes when I read their stories. These are our ASHA workers. Well, let us understand who are these in the first place. Who are they? What are they supposed to do? Why are they doing this particular task? Now, ASHA stands for Accredited Social Health Activists. They are hired or appointed or taken in by the Ministry of Health and Family Welfare under the National Health Rural Mission or National Rural Health Mission. There are approximately 9 lakh ASHA workers on the ground, on the streets of India when I am speaking to you right now. And all 9 lakh of them are women. So women are taken in for this service. Do you know what is the salary they are paid? They are not paid any salary. They are just paid a honorarium. And how much is that? It's somewhere around 2,000 rupees. That's a fixed honorarium per month, which can go up to 3,000 or 4,000 depending upon the extra work that they do, which is basically incentives for the work that they do. Now, what is their primary task? Their primary task is to be messengers between the health department and the rural population of India. These are postmen. These are messengers of the government to ensure that the health schemes reach the poorest of the poor. In the times of the pandemic, at the times of corona, what is the task assigned to them? The task that is assigned to these ASHA workers is very simple. They need to control local transmission of the virus. Now, what do I mean by local transmission? Somebody is contracted a virus outside of India, come to India, and this person can in turn transmit the virus to people in his locality. This is what is called as local transmission. And this task of controlling local transmission is given to the ASHA workers. Now, what should they do in order to control the transmission? Point number 1, they need to go house to house, locality to locality, and do a survey. Ask questions, find out the travel history, and see if anyone has a potential of carrying the virus. If anybody has a potential, they need to keep in touch with the health ministry, with the local government hospital to ensure the necessary tests are undertaken. 3, they need to monitor people who are in quarantine, who are in self-isolation on a daily basis. 4, they need to monitor whether the local transmission has happened or not by going from house to house, reaching out to people, secondary contacts, tertiary contacts of the people who have contracted the virus or the people who have come from abroad. This is the selfless task that ASHA workers are doing on a daily basis. And doing this, they face a lot of threats. What are the threats they face? Probably the biggest threat that they face is contracting the viral infection themselves. They are not provided with PPE kits. They just have one mask and a couple of hand gloves to cover. And they need to visit each one of these gullies where the virus might be hidden. 2. When I talk about 9 lakh ASHA workers, I'm not just talking about these 9 lakh women. I'm also referring to the families of these 9 lakh women. The impact is not only for these 9 lakh women. If each family has around 3 people or 4 people, imagine the impact is 9 lakh into 3 times. Those many number of people are actually impacted by this work. 3. They face abuses. They are the punching bag for all the frustration to come out, and they go through all that. We have seen in the news, we have seen in the stories of people throwing stones at them, throwing them out of their homes, quarantining these people, locked them up in their homes to ensure that these people go through all these hardships. Why do they need to go through all this? And above all, one of the biggest problems that these people face is patriarchy. Since they're all women, when they go to the villages, or why the villages, when we talk about urban families, they are abused, they are ridiculed for being women. They go through all this. And all this for what? For 2,000 rupees? For 4,000 rupees? Does that justify what work they're doing in the ground level? Definitely does not. And for all this, what is the least we can do in return? We can show some sympathy to these people and let them not suffer more than what they're actually going through. And what can we do? Simple. All of us, you, me, who are the fortunate ones to live in our homes, have the best of food, have the best of comfort, all we can do, at least what we can do, is stay at home. By not going outside, by not trying to get involved in local transmission, thereby increasing the risk that these ASHA workers face. Remember, we at least have a choice. Do you think they have a choice? No, they don't. A big salute to the 9 lakh odd ASHA workers who are tiring their day out right from morning 9:30 to around 3:30. They need to visit a minimum of 50 homes in a day. And who knows, in each of those 50 homes, who will they meet and what will they transmit and what will they acquire. Hats off to these ASHA workers. Stay home, stay safe. Prevention is better than cure.